Welcome back to the show. I asked the question to you, what is the future of telehealth? And my next guest will tell you, well, the future is actually now. Here to talk more about that, I'm joined by Dr. Richard Tytus. Dr. Tytus, welcome to the show. Wonderful to have you here. And I guess that's true, right? I mean, we've seen this through the pandemic, a lot of people switching to this sort of telehealth video or, by telephone. And as I said, the future is now, isn't it?
Oh, absolutely. So before the pandemic, 6% of doctors were using virtual medicine. And during the pandemic, we all segued into technology. Now close to 80 to 90% of doctors are doing virtual medicine.
Yeah, and you mentioned to me off camera, it's even more important that these appointments that you have, these virtual appointments, are done by video rather than telephone. Explain to our viewers why.
Yeah, so right now, I think most physicians, 70 to 80% are still using the phone, but we really have to segue to a video format, because when video format, you have that connection with your physician. You see the physician can see you, and it's a much of a wholesome exam. You can see your body language, you can see your expression, and at the end of the day, you have that real connection, which you just don't have by phone.
And one of the things I think that will, stand out for many people is security and confidentiality, right? That's a big thing. We know that when we're in person, we have that sense of security. We have that sense of confidentiality. Do we get that sense with telehealth, with video conferencing?
Yeah, so that's an issue. So when initially the pandemic came out, we were using, our iPhones, we're using Zoom. Well, we can't use that. We need to have a format that's been approved, verified, validated by Ontario Digital Health, that's HIPAA approved. And with these platforms, they are very secure, but there's a caveat.
Okay.
As long as you're in a secure space.
So what does that look like? How would you describe a secure space then?
Well, I was just speaking to one of my patients. They're at Tim Hortons. They work at Tim Hortons, and they say, "Doc, just give me a sec. I'm going to go in the parking lot. I'm going to go in my car, and then we can talk." So that's secure.
Gotcha.
But sitting in Tim Hortons, drinking a coffee, definitely not secure.
Let's talk about the improvement to the patient experience and actually the improvement to the healthcare field in itself, right? Because part of this is, and I mentioned to you, myself and my wife during the pandemic, we had some of these virtual discussions with our doctor when we had an appointment. How is that going to improve things, for us as individuals and for people like yourself in the healthcare field?
Well, I think what's going to happen, Derek, is you're going to have improved access to your doc. So it's an improved convenience. So if you're thinking about it, I had one of my patients today was on their way to Toronto. And so she has a UTI. So we were able to give her a prescription. We sent it to the pharmacy. By the time she got there, she had the prescription. So she didn't have to take time off of work. She still got excellent care, excellent service. And it's all about patient convenience, and it is certainly a green approach to medicine.
Absolutely. Let's talk diagnosis, because it's important for us, even when we're in person, right? As a patient, when we come to our doctor and virtually, what kind of questions should we have at the ready when we're meeting virtually with our doctor so that you can make a proper diagnosis?
Well, here at Banty, what we have, our video platform has the team approach.
Okay.
So you not only see the doctor, but you also see the nurse. And the nurse is able to get a lot of the details that we need. Got a lot of the metrics. What's your blood sugar? What's your blood pressure? And then she conveys all that to the doctor. And the doctor is coming with when he does see you, he sees a lot of the base information, and that really helps with the diagnosis.
Yeah, no, I couldn't agree more. And as you said, the future is now. More and more people certainly looking towards this for many different benefits, and you've described most of them here today. Thanks so much for joining us, Dr. Tytus. Really appreciate your time today.
My pleasure.
All right, we brought up the website there if you want to find out more information about this particular resource, and make sure, as he said, you're in that reliable area to have those conversations. We'll see you next time here on Daytime.